cool. All right. Yeah. So it's so funny. It was just like in the zone cleaning in my kitchen. All of a sudden I looked down, it was like 5 till and I was like, oh crap. And then I saw that you were in and I was like, okay, oh shoot, Jackie.
No,
Oh,
no,
sorry.
no, no, take your time. No, I was busy this morning prepping all my food for the week and cutting up all my
Oh,
vegetables, cleaning
nice.
everything and getting everything all set. And
Yeah.
I was kind of like timing everything,
Mhm.
and I was like, because yesterday I got into a heated discussion with my husband and totally like spaced out on an appointment that I had at 11:15. I was like, oh, and she sent me a text and I'm like, oh, I'm so sorry. And so, yeah, so
Yeah.
I understand. So no
Oh,
problem.
well, thank you. Yeah. I have to do some food prepping this evening. So I'm looking forward to
Yeah.
that. Good old Sundays.
Yeah. That's the best part.
Yeah.
It's like, can it just last a
Yeah.
little bit longer?
Yeah. That I do love Sundays because those are the days that we clean the house and do the food prep and get groceries for the next week and everything like that. So
Yeah.
yeah. Wish the weekend lasted a little longer, but what can you do?
Yeah, exactly.
Yeah.
Exactly. We
Yeah.
need, I think, we need to have like 3 days of
Mhm.
weekends at least.
Yeah. Oh, I agree.
Well, that's why I'm working towards having that kind of freedom and that flexibility to be able to do that.
Gotcha.
So,
Well, that's a nice place to be where you
yeah.
can work for yourself and have that freedom.
Yeah, I'm working on it. So,
Awesome.
um, yeah. So, what do you want to talk about?
Okay.
Do you me to just share my story?
Yeah. So
Um,
I actually, I'll probably do like a quick little intro, introduce you, who you are, and then kind of
okay.
just like lead you into it. Um, it's going to be mostly free flowing because I don't like too much structure because based off of our phone conversation, I was just like, crap, I wish I just had recorded that conversation because it
Well,
was
we could do
so
it all
good.
over again.
Yeah,
Yeah,
it
I
was
mean, we could
so
do it all over
good.
again. And,
Yeah.
and I've been working really to hone and structure my online program.
Hmm.
And when you speak to Moni again, for Nikki or whatever, just tell her to call me. I
Okay.
mean, you know what? I mean, I think it's more important that she get the help she needs and we
Hmm.
can figure out everything else later.
Yeah.
I mean, that's part of my problem because I care so much about
Yeah.
people.
Yeah. I know that is so hard. You're like, I don't want to charge you or I don't want to charge too much, but like it's your worth too because you're bringing something so valuable to the table as well. So, yeah, it's kind of a hard balance to be with.
Well, I think when you're diagnosed with cancer,
Mhm.
everything's really scary. It's
Mhm.
overwhelming. Any
Mhm.
chronic disease, actually,
Yeah.
any kind of situation. And, you know, it's not like you don't, I mean, I recognize that people are spending lots of money if they're integrating natural options and
Mhm.
they're trying to bridge things, but sometimes we don't always have success or the people that we choose. And like I try to fully vet people,
Yeah.
make recommendations. I always recommend to patients, get at least two opinions
Mhm.
um, before you make a decision
Mhm.
which way you're going to go,
Yeah.
whether it's allopathic or naturopathic
Mhm.
or integrative. Like, you got to interview people because, you know, some patients don't realize that that really matters.
Yeah.
Like if you connect with that doctor, that's really an important piece of healing. And
Mhm.
there's a lot of pieces to healing.
Mhm.
And but the most important piece, which I don't think we stress to patients, and it's on the front cover of my binder here, is
Mhm.
you have the power to heal yourself. And
Mhm.
you need to know that. We think so often that we're helpless, but we're not. We always have the power of our minds. Claim and consciously use your power. And that's from Louise Hay. And, I used to think also for a long time that, you go to the doctor and the doctor is going to heal you.
Mhm.
And the doctor doesn't heal you. The doctor gives you tools.
Mhm. Yeah.
And, for doing this as long as I've been doing it,
Mhm.
that's the key. And, I ask patients, do you want to heal?
Yeah. And I think that's such a simple concept that people don't as don't easily wrap their brain around, like the body innately wants to heal itself. It's like, how can you provide it the tools to do so? And people just can't wrap their brains around that sometimes. So, and
Well,
like you
I
said, do
also,
you want to heal?
right. And I think people do want to heal,
Hmm.
but I think a lot of times we put a lot of faith that we go to the doctor and the doctor's going to give us whatever we need and we're going to instantly heal,
Hmm.
not realizing, no one having the conversation with someone. No, you have a responsibility. You have a part in it. And I
Hmm.
know this because I used to administer chemotherapy for
Yeah.
10 years.
Yeah.
And when I would administer chemotherapy and the patients would come in, the doctors would say, no, 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 don't worry about food. Don't worry about that. All you have to do is come for your treatments on time.
Yeah. That's
That
mind
was it.
boggling. That's mind boggling. Yeah.
And it was a whole side. So that's,
Hmm.
part of that was, I went through nursing school and I said I never do cancer.
Hmm.
I would never wind up in oncology. That was never my plan.
Yeah.
I always wanted to be a surgical nurse. I
Hmm.
really wanted to be in the OR.
Yeah.
But it didn't work out that way. And somehow oncology chose me.
Yeah.
And after being there for so many years, it's like you learn so much. There are a
Hmm.
lot of gifts that you're given.
Hmm.
And one is to know that life is short and you really have to live and you have
Hmm.
to make choices. And I think a lot of patients don't realize that they have choices.
Yeah.
Did you feel, Jess, when you were going through your journey that you had a lot of choices?
Mm. Yeah, yes and no. I think had I needed the radioactive iodine. Um, I I was opting not to take it. I did not want to take it. My big takeaway was, we talked about this, radiation is just a nasty, nasty thing. And I know radioactive iodine's slightly different, but I didn't want to subject my body to that extra yuckiness. Like
Mm-hmm.
it's to me, it's just this yucky foreign thing that, like a lot of people have adverse reactions to. And every person who either had Graves' disease or some sort of thyroid cancer that they needed, or thyroid issue that they needed the radioactive iodine, and every single one of them was just like, I don't recommend it. Don't do it if you can avoid it. And I was like, holy crap. But luckily I haven't had to have the radioactive iodine. So I didn't have to, I guess, fight with my doctor. So,
Well, well, that's great. I mean, but you actually, and that's one of the things I tell
mhm,
patients because sometimes
mhm,
people don't even think about it.
mhm,
I tell people like one of my clients, he came to me and he had prostate cancer,
mhm,
and the doctor was recommending surgery and radiation. No surgery, just radiation. And they
mhm.
really couldn't pinpoint it, but they were going to just radiate his entire pelvic area. And I
Wow.
said, how about we call the American Cancer Society? They have a list, and maybe we can find someone who's already gone through that. And you
Mm,
can talk to the person and find out what side effects that they're left with
mm,
afterwards.
mhm,
Um, and that's another reason why I do this business, because I feel like so many patients are left broken and devastated and not whole,
mhm.
and they need to be made whole again.
Yeah.
um, you know, and so he did, and he called and he spoke to someone and found out that the gentleman had urination issues and bowel issues and all kinds of
Oh,
things. And
yeah.
so, he was in pull-ups,
Oh God.
because he was having leakage of everything. And I said, listen, what I teach people is
Mhm,
lifestyle modification. It's
mhm,
100% you.
mhm,
I will be here to hold your hand, to be your cheerleader, to give you the information, to help you get strategies, to do
mhm,
research. Like, for example, like if you're not really a good cook, but you need a chef maybe who's organic and who's going to abide by gluten-free and dairy-free and come and make meals for you because you just can't do it. I'll
mm.
research and find something in your area, and give
Yeah.
you the option. It's a matter of you taking the next steps. And so it's quite funny because I've been working with this gentleman for 4 years, Now it's just, he calls me every once in a while. He goes to the grocery store and he's like, can I have this? And I'm like,
Mhm.
what does it say on the box? How many ingredients is it?
Yeah,
You
yeah.
know, and, so he just calls me, and then he calls me every time he goes for his scans or something and
Mhm.
tells me, he's like, thank God,
Mhm.
everything's negative. And,
Yeah.
um, and he thanks me. I'm like, don't thank me. Look
Well,
in the mirror. You did the hard work.
yeah.
I mean, because it's hard work getting
Yeah.
healthy.
You were his guide though. Like he
Mhm.
like you were a huge part of his journey and his recovery and getting to feel good again. So of course he's gonna.
Well, yeah, I know, but it's kind of like,
Yeah, but
the way
he
he
did the ground. He
worships
did the
me.
yeah. He did the
He did
groundwork.
the
You were
work.
the
I mean, there are people that I've shared this information with,
mhm.
and they can't follow through and they
Yeah,
can't do the work,
yeah.
and, so now what I'm doing is I'm trying to work with people to try to figure out what their blocks are,
Mhm.
to try to remove those blocks.
Mhm. Yeah. Well, this is kind of like a perfect segue. It's like we did a little intro chat before the official introduction, but I think that's just, I guess, our relationship. We just start chatting and going off, and it's great. But
Yeah.
I have here today Jackie Shore. She is a registered nurse, oncology certified nurse, and now I would say most recently, a professional cancer coach. Welcome, Jackie. I'm so thrilled
Thank
that
you.
you found me and you contacted me. And we initially had a phone call, and I was driving to LA. I was going to be in the car for like an hour, thinking I was like, oh, this will take like 15, 20 minutes, but we talked for like the whole hour. So I was just chomping at the bit to try to, be able to record with you and get you on to join my Cancer Story podcast. So I'll let you kind of take it away. You have like a multi-level story, I guess, to share with me, um, and yeah, I'll just kind of let you go with it and tell your cancer stories and whole, I guess, journey to getting to be a cancer coach.
Okay. Well, thank you. Thank you so much. And
Oh my
this has
gosh.
been really wonderful. And,
Yeah.
just to help people, that's my mission in life.
Mm-hmm.
And so my story goes back to 2005, actually. Well, 2003, I graduated. I went back later in life to get my nursing degree. I have a younger brother who's 2 years younger than me that suffered a grand mal seizure at the age of
Oh,
2. So we were in and out of hospital. So I was very familiar with the medical system. I saw lots of different things. When I had a baby, my mother had a baby brother 10 years 10 years younger than me.
mhm,
And this baby actually started exhibiting signs that my younger brother, his older brother, had also as a baby. My father kind of like really got freaked out.
mhm,
And so they brought the baby to New York City, and they were doing lots and lots of tests on the baby. And they found out back in the 70s that both of my brothers had this um, idiopathic hypoglycemia. So
mm,
I grew up in a family that were in and out of hospitals all the time. And basically, my younger two brothers had to have be fed every 2 hours because their blood sugars would drop,
oh
and all of a
wow.
sudden they'd have seizures. And 2 hours around the clock. And then as he grew, eventually it turned into, I believe he can go like 4 to 6 hours now as an adult.
Oh my
Not more than
gosh.
that. He can't fast, otherwise he'll be in trouble.
Okay,
And
wow,
he does, and
that's
he doesn't feel it either.
okay.
And so
Oh.
it's interesting because of how my journey has come. I found out that we actually have probably a family genetic predisposition to something called cryptopyrrole. But I'll get back to that story.
Okay, I was
Yeah,
like, I've
it's
never heard of that.
really, yeah, it's really kind of cool how I came full circle to find that out.
Mhm,
And unfortunately, both of my brothers, my mom, they're not interested in getting tested, but I would be really curious to see if they have that.
hmm,
But so fast forward, I always wanted to be a nurse because of what happened to my brother and everything like that. And I went back to nursing school as an adult with 3 kids, 3 dogs, and I did really, really well. And I graduated.
wow.
And in 2003, we moved to Arizona, and I started working in the hospital. And nights just didn't agree with me.
Mhm,
So I eventually had to leave nights, and I worked home health. I worked where did I work? I worked also in the schools, as a
Okay.
cancer, as a school nurse.
Like, yeah,
I felt
okay.
like
Yeah.
I felt like I was running my mini ER. And then one day, I had met this recruiter, and this job came across her desk. She called me, so I went for it. And the only downside was it was in the cancer world. And I said, "Oh, I don't do cancer.
Yeah.
I just, she's like, no, 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 go for the interview." I went for the interview. Of course, I got the job.
Hmm.
And it was interesting because it was like, okay, God, maybe this is where you want me to go. And so I went there and I started learning, and I started learning lots of lessons from lots of different patients and lots of different things. And remember, I was very allopathic.
Yes.
I was very into the medical system. So it wasn't until 2009, when my mom was out visiting for my son's high school graduation, when she started coughing up blood on the football field.
Mm.
Now, I always knew that one day she would be diagnosed with lung cancer because she was a 2-pack-a-day smoker. So,
Wow.
of course, it's not rocket science. Smoking, I mean, they declared it in the 40s. There was an ad on the paper, the Camel, you know,
Yeah.
um, all doctors smoke Camels,
I
right?
can't believe that. I cannot
And,
believe that.
they glorified that. And, we know that smoking is not good. It's toxic. It's carcinogenic, and it
Poison.
causes cancer.
Yeah.
And so, but that's okay because I was in the cancer world at the time, so I knew what to come. So when when we got her to the emergency room, I was able to pull the doctor aside and ask him, instead of doing a chest X-ray, if we could do a CAT scan. Because what people need to know and understand is that sometimes, if your cancer isn't like a half a centimeter big,
Hmm.
it's not caught on a film. And if it's caught on a chest X-ray, it's really, really big.
Okay.
So
So like the CAT scan is more detailed, or it's like it's
it's
stronger.
it's stronger, and it actually, yeah, like they say, according to what I've been told, is like CAT scans are equivalent to 100 X-rays.
Oh, wow. Okay.
The
Ugh.
radiation that you would receive from 100 X-rays. So yeah, so the CAT scan. So in any case, in the CAT scan, when I picked up all of her records the next day, I was reading the report,
Okay.
and the report was recommending that she go for follow-up because they saw a spiculated nodule. And because I had been in the oncology world, in the office, treating patients, administering chemotherapy, I would
Hmm.
hear their doctors talking in the hallways when they were explaining, scans to patients and things at different times, that I knew a spiculated nodule was not good. So my mom went back to New York, and she thought everything was okay. She just thought she had a pneumonia.
Oh.
And I explained to her that she's going to have to get a repeat. And CAT scan, when she got there in 6 weeks, she's like, "I don't want to do that. Medicare's not going to cover it." I'm like, "Medicare will cover it. Trust me." And so I kind of had to tell my mother before she left, because she was giving me a hard time, because she wasn't planning to get any follow-up care, that I'm not a doctor, but I have a feeling that my prediction of all these years of you smoking is going to be coming true. And she
Yeah.
looked at me, and I said, "Yeah." I said, "You thought it wouldn't catch up with you, but I think we're going to be dealing with this." I said, "You go back and do your thing and not think about it." I said, "I'm going to do some research. It won't kind of hit the fan, unless the next CAT scan shows that it's grown, or it's, changed, or something like that.
Hmm.
So let's just kind of, put our emotions aside, because what people don't also realize is emotions can also contribute to cancer. What Biology of a Belief by Bruce Lipton, if you've ever read that book. But
No.
oh yeah, so the thoughts you think can actually bring things about. There's a
Okay.
lot of things, yeah. So um, with that, my mother went home. I started doing research. I gathered names of doctors, different procedures, and different things like that. And so
Mm.
then 6 weeks later, yes, it does show a spiculated nodule. It's still there. It's not. it's a teensy bit bigger, and it could have been different machines. So now it's like, what do we do next? Well, they wanted her to go for a biopsy. And I said, no biopsy. I said, you're going to go for what's called a surgical biopsy, where they're going to go in and wedge resect that portion of your lung out. And then we'll go from there. They can do what's called a frozen section on the table. So while she's under anesthesia, they're going to stain the tissue and
Okay.
see if it's cancerous cells.
Okay.
And
And
that's
if it,
exactly what they did.
okay. So since they did see it was cancer cells, like they just kind of kept her under anesthesia and took the rest out, or?
Yeah.
Okay.
So what they
Okay.
did was, well, they took out the lung,
Mm-hmm.
right? And then they went in. And so what the surgeon and I had talked about ahead of time. And so my
Mm-hmm.
mom went for 3 opinions. One wanted to do chemotherapy first. The other one wouldn't do a surgical biopsy, but he wanted to do a biopsy, then surgery, and then chemo and radiation. So every doctor she had spoken to pretty much had a different plan.
Okay.
um, no two plans were exactly identical, but the surgeon that we worked with was a surgeon who was willing to do the surgical biopsy. So my mother didn't have to undergo a biopsy first. So by doing that, you have one surgery, because the thought is, if it's not good, you're going to be taking it out.
Mm-hmm.
So why do 2 steps? Why not do 1 step?
Yeah.
So this doctor agreed to it. So what she said to us is, if it is cancerous, I'm going to remove the rest of her lobe. And so my mother then, you have 5 lobes of your
Mm-hmm.
lungs. And so one whole lobe, her right upper lobe, was removed. And
Okay.
eventually the other lobe, expanded and grew a little bit, and,
Yeah.
it's a little bit bigger. So, with that, because once they got all of the pieces of the lobe out, they put it back together. The doctor called and said, there are quite a few lymph nodes that were close to the edges of the lung, and mom had a spot on the left side too, not just the right. She goes, we need to go in and do the left side and see if the left side is cancerous as well, because that will up her staging. That would mean she'd go from a stage 3
Okay.
non-small lung cancer to a stage 4. So she went in for the left side 2 weeks later, and they wedge resected that, and it was benign. So she's missing a little section of her left lower lobe. And so she's still living 11 years later.
Love that.
Yeah, she did go through chemotherapy, 16 weeks. But
Okay.
along the journey, I was educating my mom. Now, my mom has a hearing loss, and my mom, I'll never forget when she was pregnant with my baby brother, who's 10 years younger than me. I was old enough to remember things. And every
Mm-hmm.
morning I would wake up to listening to her heave in the toilet. She had such horrific morning sickness. It was
Ugh.
terrible. And so, what I did learn from my cancer administering chemotherapy, and this is good for any listeners out there,
Mm-hmm.
so that to ask for more antiemetics, and those are the anti-nausea drugs. I
Okay.
would I would always ask a woman, if they had children,
Mm-hmm.
did you have pregnancy nausea? Did you have nausea?
Mm-hmm.
Because if you did, it seems like the chemotherapy attacks the same parts of the brain. So there seemed to be a correlation.
Oh, that's
And
interesting.
yeah. And so when I worked with women, if they were really nauseous when they were pregnant,
Mm.
then I would right away go to the doctor and say, could we get more anti-nausea medicine on board, or stronger, and things like that, especially when I knew in the drug's profile, it said that it was more nauseating causing.
Mm.
So the recommended chemotherapy that the hospital in New York that was working with my mom recommended was called cisplatin and navalbine. And navalbine's really mild, but the
Mm.
cisplatin really causes hearing loss and really is causing a lot of nausea. And so I had scoured the research on PubMed.gov, because I'm a research junkie, and found that there was actually a study showing that there's another drug out there, cisplatin's cousin, called carboplatin.
Mhm.
that was less, caused less nausea and also caused less of a hearing loss.
Okay.
Patients didn't lose their hearing.
Did your mom have hearing loss prior to chemo? Oh,
No.
okay. Okay. So that
Yeah,
would, okay.
she just was, she would always be, and she would never use hearing aids or anything like that. And so I knew that, I didn't want her to have more of a loss.
Okay.
So we asked the doctor in New York, and I showed my mom the study. I explained it all to her, and basically what the study showed was basically you had 3 months less of a chance of living, but you'd have better quality of life. So, reading those studies, and it's good for patients to understand the drugs that they're getting. What does it mean? Like, are they going for a cure? Are they palliative? Rate to, recurrence. They, a lot of times doctors use big words, especially in with a visit, especially if I'm there, because
Mhm.
sometimes they'll talk very clinical. And I always try to ask them to dumb it down to kindergarten language, please.
Yeah.
And I asked the doctor to explain things to my mom. And then I said, would you be open to, instead of using these drugs that you're recommending, using this one? And here's the study. And he said, oh, absolutely not. We don't deviate. And that's when I turned to my mother and I said, you know what? There is a doctor out there, and there are other doctors who are willing to do that if that's what you want. Because I
Mhm.
understand, I wanted to make sure my mother understood completely what the difference was, quality of life and 3 months less with using the carboplatin. And at that point, they were giving her like a 36% chance of living 5 years with chemotherapy with her diagnosis. That's what
Oh,
the doctors said to her.
oh, that's
They
not
really
that
scared
good.
her. She was
Yeah.
really, really scared. So my mom did the chemo. She actually came out to live with me in Arizona. And the doctors that I worked with, they were willing to do that. I asked them, and they were willing to do that and make that substitution
Oh, good.
with full knowledge. And so, yeah, so, that's really important for patients to understand, is that, you don't have to use the first doctor you're referred to. You have choices. And so while we were going through this whole process, my mom said to me, she goes, what do people do if they don't have someone like you? I'm like, I don't
Yeah.
know.
Like kind of screwed. Like
Yeah,
for you to be your mom's advocate like that, like you set her up so much better for success.
right.
And
Thank you.
yeah, and people who, like she said, don't have somebody like you, they may have had a less than thrilling experience, not lived as long, or just the quality of life was not as good as it could have been, that they didn't know what their options were.
Right. And
Yeah.
so what I said to my mom, at that point, I kind of like filed that in the back of my head. And so when we
Yeah.
got done with her ordeal, I started searching, like, what can I do? How can I help other people? Because, as I administered chemotherapy every day,
Mhm.
I spoke to patients. My hearts were there. So many of them, would say to me, "Oh my God, if I had only known, that it was going to be like this, I would never have done this. If I had only known," and
Mhm.
different things. And so the more and more patients would say those things to me, the more and more I kept saying to myself, "Oh God, I got to get out there. I got to, help people." So I decided to go back to school to become what's called a nurse patient advocate. At the time, back in 2010, when I was researching this, I didn't think to look for a cancer coach at that point,
Mhm.
because I figured I was a nurse and what I was doing was advocating for my mother. I was educating the patient for them to make educated medical decisions. And that's what I really wanted. You
Yeah.
can decide. I mean, I work with people now, and people make all kinds of decisions as long as you have the information and the full information.
Mhm.
And sometimes it's not that you're not given all the information, but you just right away just go with the program and not realize that, oh, if I do this, what are the after effects? And a lot of times, I think once you hear those words, you have chemo or you have cancer, excuse me,
Mhm.
those are the three most devastating words to hear.
Yeah, it's
Um,
scary as hell.
yeah. And I think that it reminds me of Charlie Brown when I used to grow up watching Charlie Brown and the teacher's voice on
Yeah.
the,
Wonk,
the,
wonk, wonk, wonk,
wah, wah,
wonk.
wah, wah,
Yeah.
like, forget it.
Yeah.
After you hear
Yeah.
those words, you don't hear anything.
Yeah.
So, a lot of people don't know, they go to appointments themselves as opposed to
Mhm.
bringing someone with them,
Mhm.
having a tape recorder that they should be tape recording things.
That's a good tip. I
Yeah.
wish I did that.
A lot of doctors don't like that. So if your
Yeah.
doctor doesn't like that, that's a cue to you that
Yeah.
that's not the doctor to work with. If he's
Yeah.
worried that you're trying to tape record him so that
Mhm.
you remember what was said,
Yeah.
that's an issue.
Yeah.
And I've had doctors, and actually in Arizona,
Mhm.
um, you can tape record. I mean,
Yeah.
there's a law. Only one party has to know you're tape recording.
Oh, really? That in Arizona? That's
Hmm.
that's interesting. Because I know,
Yeah,
like in Washington, I think both parties need to know. I don't know why
right.
I know Washington. I listen to too much true crime. I think that's I think
Well,
that's the
I try to
problem.
be respectful. I try to
Yeah.
be respectful and mindful and pull it out and ask.
Yeah.
But
Yeah,
I
of
mean, I
course.
have had doctors, and after the visit that I've been with the patient, I say
Mhm.
to them, you know what? I think it's time for you to find another doctor. I said that
Mm.
was really uncomfortable that they're afraid, to
Yeah.
educate you, because that's what a doctor, the word in Latin, doctor means teacher.
Mm.
But it's interesting because I don't know about you, but I don't see many doctors doing a lot of teaching
No.
nowadays. They
No.
don't have time. They have
Just a
7 minutes.
carousel of patients.
Right. So when I went for my nurse patient advocacy program, I wound up um, being opened to alternative medicine. My eyes just opened. And this whole program was talking about merging Reiki and acupuncture, acupressure, chiropractics, grounding, like all kinds of modalities that
Yeah.
are out there to help a person heal, that it's just not the drugs. It's not
Mhm.
just the surgery. It's not just the chemo. And
Mhm.
it was like, oh my God. So I started becoming an avid student. And the whole program was based on this new medicine called functional medicine. I
Mhm.
don't know if any of your listeners are familiar with it, but basically, it's doctors who are looking at you as an entire entity and how your body functions as a whole, not as a part. And
Yeah.
unfortunately, medicine has become very compartmentalized. And they realize now, and that's why there's a really big surge of doctors who are going into functional medicine and are trying to learn how to integrate all of this, because they're realizing they went into medicine to heal their patients, but they weren't healing them,
Mhm.
and they're just throwing things at them to treat them. So that's what I was learning, functional medicine. I became an avid student, going to conferences and all over. But my passion was still working with cancer patients, because I felt that so many patients, cancer patients especially, were lost, confused, scared, and they were making decisions based out of fear, not knowledge.
Yeah.
And so if there was a way that I could help people, give that, empower them with the knowledge, and all of my knowledge comes from pubmed.gov. I do the research, I read the
Mhm.
studies, I explain the studies, and give you that knowledge for then, we craft questions for you to ask your doctor. I mean, I do have, the 10, 20 best questions. I've got lots of questions. What are the best questions to ask the doctor for different things?
Mhm.
But when I'm working with someone, if they want specific to studies and things like that, and handing people studies to take. And perfect example was a client of mine who was actually diagnosed in Arizona with a very, very rare tumor. It was called a leiomyosarcoma. It was in her peritoneum,
Oh.
and it was very, very rare. And I said to her, you really need to go to a big university center. You do not need to stay in Arizona. We need to. And I did research,
Mhm.
and she could go to Sloan Kettering, she could go to Boston, Dana-Farber, John Hopkins, MD Anderson, Sloan, UCLA, and Stanford. I mean, I researched all of them. I got connections in every one of them. Like, I called, spoke to secretaries of the heads of the departments, found out how we could do a second opinion and so forth. And I presented all that information to her, and she chose to go to UCLA.
Okay.
And so we flew to UCLA to get this opinion, and she wound up working with the doctor, and she's been in remission quite a few years now, and doing really well. And so I had another young woman who, unfortunately, that didn't turn out so well, but it did give her extra years. She was 19 at the time, and she was having some heart issues, and nobody in Arizona knew what to do with her. They actually flew to the Cleveland Clinic,
Oh, wow.
and they actually opened her up to do this heart surgery, thinking that it was heart surgery. And when they went in, they actually found an angiosarcoma of the heart.
Oh my God.
So at that point, they closed her up and told her to go home out in a hospice. And, she was really upset. Family was really upset, and they were asking, what we could do. And so I brought some different options. I actually connected with Dr. Ravi, who was the head of and had loads of experience with sarcoma at MD Anderson in Texas.
Mm-hmm.
And I spoke with this Dr. Reardon, who was like the big heart surgeon in Texas. And I explained, and he called me from England one night, and I was explaining what was going on.
Mm-hmm.
And so I presented that to the family, like, here are doctors who, have some things that can help you. And so the family decided to go out to Texas and get treatment. And they were able to give her 3 more years. She was able to
Wow.
have her dream trips and her Make-A-Wish. And she made it to her 21st birthday, went to New York, went to some plays, got to do some of the trips that she wanted to do.
Mm-hmm.
Unfortunately, they just weren't able to, get it shrunk and get it surgically removed and
Mm-hmm.
things like that. But that was their intention, and they, but she did get extra time, and she was beautiful. So, I've got both stories, but you have to get the information to know who to go to, right?
Yeah, absolutely.
Because what sometimes people don't understand is when you go to the big universities, they're on top of the research.
Yeah.
That's where a lot of clinical trials are going on,
Mm-hmm.
and that's where they're doing what the doctors in your local neighborhood are putting into practice. But that's like 10 years ago.
Yeah, yeah. I was about to say that
Okay.
takes so much time, like for that trickle down effect. Kind of like when books are released, like educational
Mm-hmm.
books, like textbooks. They're so old by the time they actually get printed and out there. Like the research is so old compared
Mm-hmm.
to going on
Right.
PubMed, like getting the fresh stuff right there online.
Right. And so, and that's what I do when I have people with rare cancers. I mean, there are a lot of local offices that aren't even doing genetic testing on breast stuff. Like, so it's kind of like patients need to know that there is personalized medicine out there. There's lots of different places to hook into to get their tumor tissue looked at, to get the delicate idiosyncrasies of their tumor. Because I remember many, many years ago when I started going down this rabbit hole, or my eyes being open to alternative medicine,
Mm-hmm.
I read Suzanne Summers' book, Knockout, where she was interviewing
Yeah.
tons and tons of cancer doctors.
Mm-hmm.
She herself is a cancer survivor.
Mm-hmm.
And everybody thinks of her maybe as that ditzy blonde on Three's Company, but that
Yeah.
woman is really smart,
Yeah.
impressively smart, and everything that she's done. And so when I read that book and read the beginning of her book, actually talks about her story.
Mm-hmm.
She had just gone to her integrative doctor. She had her scans. Everything was good. But then 3 weeks later came down with this horrific lung disease that they wanted to radiate her lungs. And if had she agreed to it, they thought it was the lung cancer throughout the lungs, but it wasn't. It was valley fever.
I was going to ask if it was valley fever.
It was valley
my
fever.
my husband got valley fever, and I was one who figured it out because he went to a doctor in Florida, and Florida doesn't really know what valley fever is. But
Right.
sorry, go ahead. I was just like, holy crap,
No,
I
and
think it's
that's
valley fever.
yeah, and that's a problem. I mean, so
Mm-hmm.
think about it. If Suzanne wasn't smart enough,
Mm-hmm.
and if she consented, or she hadn't had that visit with her doctor where the scans were all clear previously. But the
Yeah.
hospital was very adamant, and the doctors, and, so patients, you are your best doctor.
Hmm.
If I can leave your listeners with, you have to sit there, meditate. You are your best doctor. You know your body. I mean, I'll never forget when I woke up without valley fever. And unfortunately, I'm starting to train my husband as an advocate and to think a little bit like me, which is really hard because he's totally not medical.
Hmm.
But, that was back in 2015. And I went to sleep. I was fine. I was doing home health. And I woke up at 2:30 in the morning and I couldn't breathe.
Oh my gosh.
Couldn't
Okay.
breathe. My husband thought I was having a panic attack. He's like, "Oh, you're having a panic attack. Just go back to sleep. You're
You're
okay."
fine.
Yeah. I went and took a Xanax.
Yeah.
Didn't work.
Nothing. Oh my
It's like
gosh.
after about an hour of like, putting my, like, kind of like in a triangle and trying to breathe and get air.
Hmm.
I woke him up and I said, either you're taking me to the emergency room or I'm calling 911. Those are your
Hmm.
choices. And I could barely even speak in the emergency room.
Oh my God.
Um, it like I couldn't advocate for myself. So they, of course, did the chest X-ray. Oh, she's got a pneumonia. How does a woman who's not sick,
Hmm.
okay? And this really needs to happen because in the Phoenix emergency rooms, I've been
That should be the
petitioning.
first thing they
It
think of.
should be the first thing. It's like if you listen to my story, I was
Yeah.
fine day before.
Yeah.
I was around patients. I was fine. I went to sleep and woke up and couldn't breathe.
Hmm.
No symptoms of any kind of cold, chest issues, anything like that. And they would not test me. Now, mind you, so I went home. Of course, they gave me Levaquin, which I didn't want to take, and I didn't
Hmm.
take. And then next thing I know, my doctor's office was closed on Thursday.
Is
That was
Levaquin for pneumonia?
well, it's a
Or
broad spectrum antibiotic.
oh, okay.
And
Okay.
what Levaquin can do is it can actually snap your tendons.
Oh,
Um,
yuck. Okay.
yeah, it's a side effect that a lot of people don't realize. If you read about some of these drugs, it's one of those drugs that you can have problems with, tendons, ACLs, all kinds of, tears of things.
Good to know.
So then what happened was Thursday, my doctor's office was closed. And he was an integrative doctor that I was working with at the time.
Hmm.
And he wasn't in. So I just sat on my rocker recliner in the living room and just waited till Friday. And
Yeah.
Friday I called the office and he's like, "I'm really booked." And I'm like, "I need to come in.
Yeah.
I walked in my pajamas, no bra, in my bathroom. Like my husband was like, "You're going out like that." I
You're
felt
like,
like
yes.
I felt like crap.
Hmm.
I was like, really, and I had this rash all over me.
Hmm. Hmm.
Oh my God. And so when I got to his office, he sent me right to the hospital, because he didn't know if I had blood clots. That's what he was thinking, either blood clots or valley fever. And he called the
Hmm.
hospital and he asked them to work me up for both. The hospitalist in the emergency room. So now this is my second emergency room visit to the same hospital system, but two different sister hospitals.
Hmm.
Let me tell you, they got 5-page letters after my hospital stay with them. The doctor in the emergency room decided he didn't want to listen to my primary
Oh
care
no,
doctor.
that's ego right there.
Right. So
Hmm.
he worked me up for the PE and he said that I don't have a PE and they don't look at valley fever in the emergency room. And so then I went home over the weekend. And Monday morning, I went right back to my primary care doctor who drew my blood. And by the following Wednesday, 1 week later, I was finally diagnosed with valley fever. But there are a lot of people, especially in Arizona, California. California has also like Rocky Mountain fever
Yeah.
over there. It's
Hmm.
the same kind of thing.
The
It's a
mold, the
fungus that gets
spore.
into
Yeah.
the spore that gets
Hmm.
into your lung because we have these dust storms in the
Yeah.
desert. And
Hmm.
so people need to be, recognize that. And there
Hmm.
are a lot of people who don't, and they don't know. And then, they go around and they're sick and it doesn't clear up. And valley fever can disseminate and go into other
Destroy your
organs,
lungs.
can
Just destroy
not only
them.
your lungs, but it can go into other organs and
Oh,
settle
okay.
other
I
places
didn't know that.
too. Yeah, it can be really devastating. It can actually, I have a very good friend who it pretty much devastated her. She had to go on disability
Oh.
because she was on the drugs for so long too. And the medications to heal yourself are also really, really bad, that it takes you a long time to heal.
Mhm.
So thankfully, I bounced back quickly. I was doing a lot of homeopathies, and because of I was dabbling with things,
Yeah.
friends were sending me, so I was doing all kinds of remedies. I had all
Yeah.
my potions and everything that I was doing to boost my immune system. And
Yeah.
thankfully, I'm doing fairly well right
Good.
now. So that's good. So as you know, people need to understand. I mean, I couldn't even talk to even advocate for myself. But
Yeah.
it's really important that you have these discussions with your family members, know who's going to advocate for you, always have a notebook, a tape recorder, write everything down, so that you have all this information. Because medicine is medicine, and they're
Mhm.
practicing.
Mhm. Yeah. Oh my gosh.
So yeah, and so as I started getting patients in my patient advocacy business, I was
Mhm.
attracting more and more cancer patients to help them navigate the cancer world.
Yeah.
And so I decided I really saw the patients who were integrating um, both sides did better, or had better quality of life, lived longer. Um, you know, I wanted to really help them. So I wound up taking a class to become a cancer coach, an integrative cancer coach through Cancer Coaches of America.
Mm.
And I've been certified since 2015 for cancer coaching. But I've basically done it one-on-one, that I'll come to your house and keep it local. Now I'm
Yeah.
going virtual and online
Yeah.
through Zoom.
Yeah.
So I can help anybody anywhere get the information. And I focus on 4 areas: nutrition, which is really big time. I focus on supplementation and genetics to
Mhm.
understand. I also focus on toxicity and detoxing the body and the
Mhm.
home and everything around you,
Mhm.
and also the spirit and how much we need to, deal with our emotions. I've
Mhm.
always, whenever I work with someone with cancer, and I don't know if you're aware of this, but a lot of patients think that cancer is this foreign invader.
Yeah.
It's not.
It's your own cells
It's your own cells that
mutating.
have become
Yeah.
broken and sick. And we have an immune system, and our immune system is supposed to destroy them, because every day we all have cancer cells going around our body.
Mhm.
And our immune system's purpose is to destroy bad things. And so what happened is our immune system didn't catch those things. And then you've made your body very hospitable to cancer. And so then a tumor is basically cells clumping together and forming a mass.
Mhm.
And so that's what happens as it grows. And sometimes that could take 7, 10, I've even heard up to 25 years to
Holy
grow
cow.
inside of you. So it's
Wow.
not something that happens overnight. Usually, most of the time, I say 7 to 10 years. And when I'm working with a client, especially when we're going into the emotional work, um, I say, what was going on 7 to 10 years prior to your diagnosis?
Yeah.
What was life like then? You had a major trauma. Something happened in your life, and
Mhm.
that you're keeping inside of you, that we need to heal. And you don't have to fully disclose that to me, but that you've got to kind of sit, get quiet, find that. And I'm telling you, every time I get people crying, every single time, like tears start trickling, because they know what that event was. And I'm
Mhm.
like, if you want to share it with me, fine. But,
Mhm.
if you don't, that's okay. And it's a matter of coming to terms, and let's go and healing all of that. And laughter therapy is great, grounding is great,
Yeah.
mantras, affirmations, loving yourself. There's lots of different things, but it's a matter of us putting those things into practice. And
Mhm.
so basically, I introduce people to lots of different modalities, and it's a matter of you deciding what works for your life. I can't tell you, do this, do this. I'm not going to prescribe that. I'm going to actually show you, maybe it's that you're very negative all the time. And so maybe we got to fix your eyes and give you some rosy colored glasses. And maybe you need to do a gratitude journal, right?
Yeah.
To really be grateful, to look around and see everything that you have and be positive. And, maybe that's something that you can do. Sit down every morning or sit down every night and reflect on the day and write 10 positive things that happened, and appreciate, everything that you've done. So it's a matter of, I kind of give you different tools, but we just lead such busy lives now. And
Yeah.
our environment is so toxic
Yeah.
that
Chaotic.
it's
Yeah.
chaos. And we're
Yeah.
always busy on the go that we don't realize that we're not connecting to the ground, connecting to ourselves. I mean, I was listening to Deepak Chopra before, and he said we've practically disconnected we're almost like we're disconnected from our bodies, and our bodies are disconnected from the earth. But we're electrical beings. Most
Yeah.
people don't realize that or even think about that.
Yeah.
Think about that. We measure our brains with EEGs, electricity, our
Uh-huh.
hearts with EKGs. We are electrical beings.
Yeah.
And so that's really important.
Yeah, I was blown away when I found out about grounding. I think it was through the integrative nutrition course that I took with IIN and the Institute for Integrative Nutrition, for those out there who are unsure of what I meant.
Mm. Yeah.
So yeah, and they touched on the grounding aspect, and it never occurred to me that I knew we were electric beings, but like how much of an impact it has on the body, and especially if you take it away because we're wearing shoes or we're walking on concrete, like, and all these things, and we're not actually connecting with the
Well,
earth.
we're in Wi-Fi all the time. Like,
Yeah, yeah.
we're inside, we're
Mhm.
not outside connecting with
Yeah,
the sun,
yeah.
so it's a matter of, um, the other thing I tell cancer patients, which I don't know if some of your listeners know or think anything, but cancer is a blessing.
Yeah.
And you have to look at it as a gift
Mhm.
because, and just like COVID right now,
Yeah.
COVID was a gift.
Mhm.
Whether or not people realize it and we're getting tired of it, we're not going to go there. But,
Yeah.
it was a gift to me because I know I was constantly on the go,
Yeah,
and it kind of made me stop
yep.
and kind of like rethink things and how I can make a bigger impact and,
Mhm.
and how to shift things. And
Mhm.
so I think that, cancer is a chapter in your life. It doesn't have to define your entire life,
No.
and you don't have to be a victim. And that's really important because I think the women that I've seen and the men who have really empowered themselves and really take their own healing into their own hands,
Yeah.
that's the key is really to do that.
Yeah. And I really like what you had touched on prior was, giving people these options and different modalities that they can try. You're not specifically telling them you have to do X, Y, and Z in this order, or else, nothing's going to work for you. It's like you come from a very like, uh, wholesome, non-judgmental place where people feel safe with you. And then also you're giving them the option to create their own course of healing. So I think that's incredible because you don't see that very often in modern medicine. So the functional and the integrative portion of you providing for them that's next level. It makes all the
Well,
difference.
and yeah, and the truth of the matter is that, what you eat matters. Food
Hmm.
is medicine.
Yes,
Food is medicine.
100%.
And I just remember once I learned that, it created a lot of controversy when I was chair siding and administering chemotherapy because I was trying to educate the patient.
Yeah.
And the physicians in my office and their philosophy was let them eat whatever they want because they're going to lose weight or whatever. And
Hmm.
so it really created a lot of,
Hmm.
eventually I had to leave the office because I just felt like I have a moral obligation. And
Hmm.
once I know what I know, it's almost like criminal if I don't share that.
Absolutely.
And so, I can't dictate to you, Jess, and say to you, oh, you have to become a vegetarian,
Yeah.
or you have to go keto or
Yeah.
macrobiotic. We have to meet you where you are.
Mhm.
And you have to look in the mirror and say, what am I willing to do to live?
Mhm.
I have to understand, if you continue to do the same thing you did before you were diagnosed with cancer, while you're going through treatment, and afterwards, you do the same thing and expect a different result, I'm going to tell you right now, it won't happen,
Yeah.
because I saw women, and the hardest part was for me was when they would come in for their checkups and then the cancer returned, and
Mhm.
they'd be like, oh my God, I never wanted to sit back here again. Like, oh my God, like, why is this happening to me?
Yeah.
And not realizing that they had a part in it, that they didn't address their stress, they didn't address their toxins in their life, they didn't address their nutrition, and they didn't realize about low levels of inflammation,
Mhm.
and how supplementation, and that they weren't working with their body to give the body what it needed in order for it to heal. I mean, I think that was the biggest lesson that I learned from Suzanne Summers and a lot of these other doctors that I met, because I've met a lot of them. I've gone to a lot of different conferences, and met different doctors along the way. And, if we can give the body what it needs to heal, it can heal itself.
Mhm.
Now, I never tell patients what to do. I'll never tell you what to do. I just give you the information. I'll connect you with someone who went down the journey ahead of you, so
Yeah.
you can find out, is that what you want? Is that what you want for your life? Because, you have to make that decision. I can't make the decision. I have seen cancer from three sides. I've seen it as a daughter and a caregiver,
Mhm.
and I've seen it as a practitioner, as a nurse who administers chemotherapy. But I have not yet, and hopefully will never, be
Yeah.
sitting in that chair. But
Yeah.
I'm not never going to tell you. I mean, I've had clients who ask me, and I'm like, it's not my decision. It's your decision. I will give you the information. Then you need to go sit, take a walk in nature, sit someplace quiet, and ask yourself, is this feel right? Does this feel right? And I'll never forget, I had one patient. She sat in my chair, and she said, I'm going to be done. I'm going to be dead. I said, really? She was so negative. She was so angry. And I kept saying to her, well, why are you doing this? She goes, because my family is making me. I said, what do you mean they're making you? She goes, well, I don't believe in chemotherapy and I'm going to be dead. And lo and behold, she was dead 3 weeks later.
Oh my God.
And I kept saying to her, you don't do something for your family.
Mm-mm.
And I've worked with families, like husbands,
Yeah.
and wives, and I'll turn to a husband and say, this is not your decision. Or
Absolutely.
family
Yeah.
members. It's a very, very personal decision. You have to feel what's right inside of you, and you have to trust that gut
Yeah.
inside of you. And, I know people who have gone straightly natural who've done well. I know people who've done the chemo route that have done well. I know people who've done both. It has to be right for the
Yeah.
person. And the main thing is that you have to start changing your life, because obviously if you keep doing the same thing you did,
Yeah. You're
you're
going to get the same result.
you're going to get the same results. So,
Yeah. Wow.
yeah.
That is such a powerful thing to say though. Say it's to a family member, it's not your decision. It's that individual who has cancer's decision. And, and it's not just like for my cancer situation, but like a decision in other ways. But I don't know if it's a type of person, more females or whomever it is. It's so hard not to worry or think about what other people are going to think, like family members. You take their um I guess advice with a lot of weight, and it's hard not to make that decision for them instead of yourself. Like I know, like just in regular life for me, like I think about like, well, what will my parents think, what will my family think, my friends think if I make this decision. And I was talking to a friend and he was like, that's not up to them, it's up to you, it's up to your happiness, it's your life.
Right. Well,
Holy
and
crap,
the
that's
thing is,
powerful.
yeah,
Yeah.
and that's what patients need to know.
Yeah.
Yes, you want to live and you want to do things for that family member or your
Mhm.
children or your husband,
Mhm.
but then you are the one who are left, and you just need to make sure that you're going to make yourself whole again.
Yeah.
Because I think so many women who do go through the roller coaster ride, and that's the other part is I like to help women get off that roller coaster ride, and men,
Yeah.
because of that watch, waiting, and wondering, when cancer is going to return, because that's really scary. And the thing about it is, I try to equate cancer to like the light on the dashboard of your car,
Yeah.
right? I
Yeah.
mean, it's blinking. So
Mhm.
what are you going to do? You're going to take your car in, right? You
Yeah.
might ignore it for a little while.
Yeah.
And the problem is that, when you have cancer, you can't ignore this anymore. You got symptoms. You had symptoms, you had signs, you just
Mhm.
missed them
Yeah.
because it was developing inside of you for, like I said, 7 to 10 years.
Yeah,
So there were
easily.
aches and pains. Your thyroid might have been imbalanced. You had hormonal issues, lots of different things, blood sugar issues. You were overweight, lots of
Mhm.
different things, people don't realize. And, God gives us lots of opportunities. Sometimes He's hitting us on the shoulder,
Yep.
hello. And when the diagnosis comes, you have cancer, that's not a shoulder tap anymore. That's a
Mhm.
2x4 over the head, and that's your wake up call.
Yeah, yeah, yeah.
But what people need to know is not a death sentence.
Mm-mm.
But a lot of people go into it because that's what we know, because we're not winning the war on cancer. So many people think 1971, Nixon declared a war on cancer. And
Mhm.
you know what? The bottom line is we're not treating any cancer any differently than we did
Mm-mm.
in the 70s, which
Yeah.
is really sad because most people think we've evolved with all
Yeah.
these new drugs and clinical trials. And I'm not really big on the new drugs and the clinical trials and stuff
Mhm.
like that. I like old things that have been proven around a long time,
Mhm.
because then you know what happens, And so I also explain to patients if they decide to go to the alternative route, it's not really, I don't want to call it an alternative route
Yeah.
because you know what? Chemotherapy came out of plants.
Oh.
All medicines came out of plants.
Yeah, that makes sense. Yeah.
We had plants. If I have a friend, Jill. Oh, she's a wonderful woman. She's in her mid 70s. And she, in the 70s, was diagnosed with cervical cancer. And
Mhm.
they wanted to take out her uterus, her cervix. She'd never have kids, yada, yada. She ran off to the Amazon rainforest, healed herself.
Oh my
Woman's
God.
incredible.
I love her.
Woman is incredible.
I love that.
Yeah. Back when, she's like, chemotherapy? Are you kidding me? No way. I'm not. She
Mhm.
was a rebel back in the day.
Mhm.
And there are more and more women that I've met throughout all the different conferences that I've attended, all these different survivors, Anita Morjani, she has an incredible story.
Hmm.
Um, there's so many, Chris Wark, I mean, all these people. And it was such a pleasure to meet so many of them and hear their stories and, to give hope to patients that they have choices and they have decisions. But the
Absolutely.
biggest decision they have to make is that they have to love themselves and that they're willing to change
Yeah.
and implement those things. And so
Yeah.
that's really hard. We're not a society that really embraces that. We want quick fixes, right?
Yeah.
We want everything fast. So that's what I do is I hold people's hands and I help them along and help give them the resources, the tools,
Mhm.
and then they have to decide what they're integrating into their life. Maybe it's waking up every morning and saying a prayer. Thank you, God, for allowing me to open my eyes and
Yeah.
connecting with God every day, you know? Or maybe it's just, like I said, the gratitude journal, or maybe it's deep breathing. I do deep breathing with people, I do meditation, all these things, all these different techniques. You just need to find what are you willing and committed to do.
Absolutely.
Yeah.
Wow. There need to be more people like you out there.
Oh, I'll work on
what
it.
you, what you do is amazing. And it's, I'm so glad that there are programs out there that are creating cancer coaches or patient advocates to help people, because it's a resource that I think not a lot of people are aware of and that they need. So thank you for what you're doing. Like it's totally eye-opening. After talking with you, like, was it a couple weeks ago on the phone,
Right.
I was just blown away with your knowledge, like your background in medicine, and then b, your passion for helping others and educating others. And I think that's such a huge thing and a huge gift to give people.
Well, I think that's the hardest part because
Mhm.
after, administering chemotherapy and working in a conventional office
Mhm.
and hearing stories like that woman who I told you who was convinced that she was going to pass away. And then I had another one who was convinced she wouldn't. And, I can
Yeah.
tell you more and more stories,
Yeah.
And after seeing a lot of those things, it was like, wow, everybody's making decisions based out of fear
Mhm.
and not knowledge. And then, they would go down this road and then have all these complications and be like, oh my God, if I had known it was going to be like this, or
Mhm.
if I had known that I was going to have a double mastectomy, and then that they don't scrape the chest wall
Mhm.
from your breast cells.
Wait, what? They don't scrape your
Oh,
chest
yeah.
wall?
Nope. Mm-mm.
Mm.
And so here we go. We put in silicone implants, which then creates a whole nother implant illness that a lot of women, there's a whole community online that they're talking about. They just never feel right because
Oh
they're
God.
growing mold. And even if they're saline or things like that,
Mhm.
or they put in the expanders and
Yeah.
how painful that is. Women have said to me, um, I just think it's really important that we really thoroughly think through things. And, I think the biggest disservice that was done to the cancer industry, I think also, is embracing this whole genetic piece and not really focusing on lifestyle modifications.
Mhm.
And, you know, when I work with women, and I've been at many health fairs, women have come up to me and told me that they have the BRCA gene or this or that, or they got their breasts. And now they're thinking about their ovaries and uterus and removing everything.
Mhm.
And I just flat out look at people. Did you cut out the gene?
And that's what, like, that is a really good question, because people are like, I don't know what that means. When you say cut out the gene, now you're saying about like the way it's expressing itself, correct?
Well, the problem is that you have
Oh,
these
okay.
genes,
Yeah,
right?
like
You
you
have
can't cut out the gene.
you
Yeah.
can't cut out the
Yeah.
gene, but
Okay.
what you've done now is taken away the places it's most likely going to show up.
Hmm. But
And so
it's not
now,
restricted to those places.
well, no, of course it's not. So it
Yeah.
can go other places.
Yeah.
So we're not educating women on how to make these lifestyle modifications to silence the gene.
Hmm.
We need to keep the gene quiet so it
Hmm.
doesn't turn on.
Hmm.
And that's another aspect of my practice that I educate people about, because just because you have the gene, that doesn't mean it has to turn on. And that goes for talking about Alzheimer's, colon cancer, Parkinson's, all genes, what we're
Hmm.
learning in genetics, because that's been a fascination. So just coming back around now to my brother's story at the beginning.
Oh yeah.
Yeah. Okay.
Nice. Nice. You did good.
So, um, I was working with my kids because after I went to patient advocacy class, I requested all of my children's medical records. And I started making a medical timeline to start looking at they were having some issues, my kids.
Mhm.
And it turned out that both of my younger two children had thyroid disease that doctors missed.
Hmm.
It was clearly in the records, completely missed. My
Wow.
kids had learning issues, attention issues, all kinds of joint aches, things like that. And I'm running to doctors all over the place, skin issues, clearly all linked to thyroid issues. So I found that out. And after I went to my patient advocacy program, I requested their records and I started working with a naturopath. who started educating me even more in helping my children. And we
Mhm.
started cleaning out our cabinets. We got rid of everything. Now, I was a mom who really thought I fed my family healthy. You know, it's on the supermarket shelves. Our government would allow products to be on there if they weren't
Never.
approved, right? I
Yeah.
didn't know. It's
Everything's
what
good for you.
I went to nursing school. They
Yeah.
didn't teach me this
No.
in nursing
And
school
that
at
blows my
all.
mind. That blows my mind. They
We
don't
knew
teach
nothing
doctors
about
or nurses.
nutrition. No, nothing.
Yeah.
So here I am thinking, you know, I make my kids a family dinner. We have a protein, we have vegetables, we have a starch, we have this nice dinner. We'll have a salad some nights, you know,
Mhm.
whatever. Lo and behold, did not know my kids had leaky gut, had all kinds of issues.
Yeah.
So we started down this healing journey. And so at the time, my son was 16, and he was like, because of everything that we were doing, he was on tons and tons of supplements. And
Mhm.
he was like tired of taking all these supplements. And
It's
he's like, Mom, I don't feel any better taking them or not taking them. I really don't feel the difference. I'm like, okay, fine. So then I decided, let's run your genetics. Let's run your genes. Maybe you have mutations. And people don't realize that. Well, you can have what's called the MTHFR genetic mutation, which means that you don't process your B vitamins quite the right way. You don't absorb your nutrients the right way.
hmm.
You can have a double mutation. You can have vitamin D. There's so many different mutations. How you get rid of ammonia in your body, all these different things. But what that does is it affects your body and how your body detoxifies itself.
Hmm.
Okay, so there's lots of different things. So we did his genetics. And so then I met with a genetic counselor, and he was looking over my son's genes, genetic profile. And I told him the story about my brother and how they have this idiopathic hypoglycemia. And he
Mhm.
goes, there is no such thing. He goes, hypoglycemia is a symptom of something. I
Mhm.
said, well, I said, back in the 70s, there's papers on PubMed written about my brothers that, you know, back then they did not have, we didn't have genetics,
Mhm.
right? It was in 2003 that the Genome Project was finished. And that's when they discovered we only had about 25,000 genes inside of our body. You know, it's not one gene per disease.
Yeah.
And it's all a matter of the switches, the biochemical switches inside the body.
Mhm.
Okay. But this hasn't gotten into mainstream medicine.
Mm-mm.
Not every doctor practices this way. They don't look at these biochemical switches. So
Mhm.
I was telling him that story, and he goes, you know, based on what I see, I believe that your family has this disease called cryptopyrrole. And I said, what does that mean? He goes, well, it means that you blow through your B vitamins and your zinc very, very fast. He goes, and that's really bad because you need zinc for like over 300 different
Yeah.
biochemical processes
Yeah.
in your body. And low zinc levels can cause constipation. Well, my kid was constipated since the kid he was born. You know, all these different things. Eye opening, right?
That's crazy.
Okay, so all you have to do is do this urine test. So, and he started, you know, my son never did the urine test, which we still need to get done, but
Mhm.
I did it on my daughter because he's like, well, does she have mood instability, this, that, the other thing? And I'm like, no, my son's not like that, but you're describing my daughter. Holy cow.
Mhm.
So we did the urine test on her because we never got him anyway. She had the highest, most cryptopyrrole he had ever seen, the highest level. Like the
Wow.
lab called him, like they'd
Really?
never seen how many. And so, yeah, there's a doctor. His name is, oh, it's Walsh, and he's in the Midwest, and he has this whole protocol with it. So it was really interesting. So that's how my interest in genes and genetics kind of got into and factored into this whole cancer process, because I think that a lot of times we don't look at the whole picture. And
Mhm.
so that's really important. That's how I educate women and men. You know, we need to figure out your genes. Do you have a detoxification? Do you have vitamin D deficiency? And, you know, do you have, most people are walking around with leaky gut.
Yep.
Most people are, you know, they don't understand how the gut and the brain connect.
Yeah.
So
It's
it's
their
a whole
second brain.
it's a whole education process.
Yeah.
And it takes time and it can be overwhelming.
Yeah. There's a lot of
And
information out there, and there's a lot of negating information out there. So, like it's
and it's
tough.
hard. Who
Yeah.
do you,
Yeah.
so I teach them from very valid physicians like
Yeah.
Dr. Leanne Keneally, who's in Leanne Keneally, excuse me. I always want to call her Leanne. Leanne Keneally,
Hmm.
who's in California.
Okay.
She's an integrative doctor who she has an incredible journey too.
Oh, wow.
I teach them from Dr. Sinatra, Dr. Mercola, Dr. Jeffrey Bland. These are doctors very well known. Dr. David Perlmutter, who's a big
Mhm.
known neurologist. These are all these integrative doctors who are putting information out there.
That's fantastic.
So, I've read so many of their books and, you know, I've just kind of culminated things, but the biggest message to people is there's no one right solution. It's what you're willing to do.
Absolutely.
And you have
Absolutely.
to integrate it into your life, right?
Hmm.
Because I can't tell you if you're, you know, um, you know, let's say you're a vegetarian and I say, oh no, you have to eat meat.
Yeah.
That's not going to sit well with you.
No.
Or if you're an all meat person, we've got to come up to terms. If you're going to eat meat, maybe you need to eat grass fed
Hmm.
and understand why. And I use a lot of movies for patients to watch
Mm-hmm.
so that they can see from other people
Yeah.
what's out there. I mean, I know once my eyes were opened, it totally changed our family dynamic and our family life. And
Yeah.
it's been a mission since 2010 now. I mean,
Yeah.
we've radically changed our lives.
Yeah. Slow and steady wins the race. Like you were saying earlier, a lot of people want that quick fix, and you know,
It's progress,
it's
right?
progress, and it's a lifestyle change. You can't just do it for
Exactly.
2 weeks and call it good. It's something that you have to commit to, and it's kind of easy if you start to feel good. So that's that's
Well,
easy to
it's
commit
really
to. But
interesting that you say that because there was a woman who contacted me, and she's actually a friend of my cousin, my second
Mhm,
cousin's, and I've spoken to her through the years, and she had cancer, and she went the natural way,
mhm.
and then her cancer returned. And I said, well,
What
she and I had a
changed?
conversation. What changed? Well, she got tired of living that lifestyle. So she started adding back all the bad things and, stress and all that stuff. So, the
Mhm,
biggest message is that you need to understand this is not a diet. This is not oh, I'm going to dip my feet in the sand and try this for a little while and see
mhm,
how it goes.
mhm.
This is, I'm committing to myself, I'm dedicated, and this is a lifestyle. And there might be friends that you can't go out to dinner with because they don't want to go to the organic,
Mhm,
healthier restaurants. And
mhm.
you might have to part friends, and there might be toxic people in your
Yeah,
life that you have to say goodbye to. And those are decisions that you have
yeah,
to look in the mirror. There might be that toxic job that you
yeah,
might have to say goodbye to and say, you know what? This is not for me.
yeah,
So that's what I help people do is kind of identify all of these different areas.
yeah.
And then we kind of work through it. And my program is 6 months long.
Okay.
And then if they want, they can buy longer support. But I try to do the education in the first 3 months with weekly sessions. And then after that, every other week and additional support and implementation. We're putting things into practice from day one, but it's just a matter of, you know, not overwhelming someone and
Yeah.
taking one thing at a time, like focus
Mhm.
on, and the one thing we do is food. So
Yeah.
that starts usually with a number one.
Okay.
So
Well, I think that's a great way to do it. Not overwhelm the person, not change too much too soon, and that's a quick way for somebody not to stick with something. So I think that's a wonderful
well, I
wonderful way to do
appreciate
it.
you. I appreciate you because, when we spoke, you're committed, you're dedicated, and you're
Mhm,
working on changing your life and
mhm,
really realizing all the things that you need to change. And
mhm. Yeah.
owning up.
Yeah, going back to what you're saying, cancer and COVID kind of being a blessing, and at first I was really angry and upset. I was like, what did I do wrong? Did I give this to myself and all these things? And I
Mhm.
started blaming myself. But then like after the fact, and like the treatment and then also changing some things, I saw it as a blessing for me to slow down. I started
Mhm.
looking at life a little bit differently. and then like giving myself a little bit more of a break and not being so hard on myself. So it's definitely been a blessing because my viewpoint and the way I think has changed, and it made me kind of analyze other things in my life, whether it's friendships, a job,
Hmm.
how I want to impact people and help people. So I think that's been a really lovely lesson for me. So yeah.
Well, I'm so glad that we were able to connect,
Yeah, me
and
too.
I appreciate this.
Oh
Oh
my
my
gosh, I
God.
appreciate your time. How can people find you if they're interested in talking with you?
They can go to patientadvocatesaz.com. I'll send you my link. So if you want to put it in your
Perfect.
thing,
Okay.
or they can call me on my phone, 602-465-2733.
Okay,
So
great.
I usually answer that Monday through Friday from
Okay.
9 to 5.
Yeah, office
After
hours.
that, you know,
Yeah.
yeah, after that, it kind of goes to voicemail,
Hmm.
and I'll get back with them the next business day. But, they can email me or reach me through my website. I'm working on changing my website right now,
Okay.
focusing more on cancer because I was focusing on everything.
Okay.
But I'm switching that, and I
Make it
haven't
more of a
quite.
niche. Okay.
Yeah, exactly. But, I've been RM Patient Advocates of Arizona for, you know, 9 years,
Mhm.
and I've built a reputation.
Yeah.
And so people know me.
Yeah.
So it's going to be RM Patient Advocates of Arizona specializing in cancer.
Okay.
And, if people are interested, I'd love to talk with them just to help inspire them and empower them and educate them because they need these tools. So,
Absolutely. Well, it's wonderful. It's wonderful speaking with you. Like I learned a ton again speaking with you, and I hope people listening to the podcast learn something and start to dig a little bit deeper into their process and their journey, just to change a few things at a time. And if you guys would like to reach out to Jackie, I'm going to post in the notes to the podcast some of the resources that she mentioned, and then also ways that you can reach out to her and connect with her. But yeah, thank you again, Jackie.
great.
This is
Oh,
wonderful.
thank you so much.
Yeah,
And I can't believe another hour has gone
I
by, almost like
know.
an hour and a half.
I was
It's
about to
like,
say
oh my gosh.
I can talk to you forever, and I definitely would love to have you back on for
Absolutely.
continued chat. So thank you for being here and educating us, and just sharing your beautiful light. So
Oh, thank you.
yeah,
And
yeah.
I look forward to it, and really helping people because there's also a lot of tests
Mm,
and things out there that you can ask your doctor to run. And if your oncologist doesn't want to run it, you can ask your primary care. And actually, some states have direct to consumer. So
mm,
there are different tests and things that you can do to find out, if you've already gone through your cancer treatment and you've gone through the chemo, surgery, radiation, whatever, you're past that and
mhm,
you're wondering. So I help people in that regard if they want to know. There's
mhm.
lots of things out there. So, yeah, and we can talk about that next time
No,
about
I like it.
circulating tumor cells.
Yeah.
Put that on your agenda. Look up some
Notes.
information about that.
Okay.
Yeah. So, circulating tumor cells and cancer stem cells. And
Yeah.
we
Okay.
can talk all about that next
Yeah.
time.
I like it.
All right.
All right. Well, great. Thank you so much, and
Thank
enjoy
you.
the rest of your Sunday. And
Yes,
I will definitely be chatting soon.
absolutely again. All
All
right.
right.
Take care.
Bye, Jackie.
Bye
Thank you.
bye.